Hi everybody, thank you for being here today for my presentation. My name is Ari Kassardjian, and today we are going to talk about decision framing in psoriasis. My presentation is titled Words Matter, a randomized controlled study evaluating the impact of decision framing on treatment preferences in adults with psoriasis and psoriatic arthritis. During this study's duration, I was a Dean's Research Scholar at the University of Southern California, and I was funded by the Wright Foundation. Below are Dr. Armstrong's disclosures. So first, I want to give you some background on the topic. What is decision framing? Well, decision framing is the way that a choice is worded. When most of us present a decision or choice to others, we tend to subconsciously use decision framing as a method of explaining that choice in greater detail. Specifically, we can frame a decision either positively or negatively, which I will be respectively referring to as gain framing or loss framing. Moreover, the framing type is reflective of how the potential outcomes of a decision are perceived. In Lefopoulos' 2017 paper studying decision framing in multiple sclerosis and the effects of exercise, they use the following examples as gain and loss frame messages. An example of a gain frame message is, if you are active, you'll be taking advantage of the opportunity to improve your cardiovascular system and to reduce your risk of developing chronic diseases later in life. Conversely, an example of a loss frame message is, if you are inactive, you'll miss out on the chance to improve your cardiovascular system and you'll increase your risk of developing chronic diseases later in life. These examples convey the information that it is better to be active and exercise, and if you are inactive, you may miss out on these benefits and risk some consequences as well. In the literature, loss frame messages are shown to have a greater impact on our decision making than gain frame messages do. This is because the potential consequences and risks hold a great deal of salience when evaluating the utility of a choice. For most of us, we tend to avoid losses rather than achieve gains of similar magnitude. In our study, we wanted to evaluate whether decision framing can play a role in patients with psoriasis and psoriatic arthritis, specifically on their treatment preferences. We aimed to examine the effects of decision framing on patients' treatment preferences for a proposed therapy among psoriasis patients with or without PSA. We also wanted to evaluate whether PSA status plays a role in how decision framing affects psoriasis patients' preference for a proposed therapy. And finally, to evaluate whether there are differences in men and women with regards to their preferences for the proposed therapy. We designed a randomized control study where we enrolled 90 patients with psoriasis with and without PSA from the University of Southern California Dermatology Ambulatory Clinics. The 90 patients were randomized 1-to-1 to receive either a gain frame message or a loss frame message regarding a hypothetical injectable medication for their psoriasis and PSA. And then each group of 45 marked their score on an 11-point Likert scale to indicate their preference for the proposed therapy. 0 indicated they definitely will not use the medication, and 10 indicated they definitely will use the medication. We also asked basic demographic information such as age in years, sex, race, ethnicity, highest education level, and whether they have been diagnosed with PSA. So now let's move on to our questionnaire that the participants received. The gain frame message reads, a new injectable medication is being developed for psoriasis and psoriatic arthritis. If you take this medication, you will have the chance to reduce psoriasis severity, reduce joint pain, and improve how you feel overall. The side effects of this medication include a small chance of pain around the injection site and a small chance of skin infections. How likely are you to take this medication? The loss frame message reads, a new injectable medication for psoriasis is being developed. If you do not take this medication, you will miss out on the chance to improve your skin, your joints, and your overall health. Your psoriasis may get worse, you may have worsening pain in your joints from psoriatic arthritis, and you may feel worse overall. The side effects of this medication include a small chance of pain around the injection site and a small chance of skin infections. How likely are you to take this medication? Here you can see the demographic characteristics of the participants. Baseline demographics and PSA status were comparable between the gain-framed and loss-framed groups. The average age was 50 years old. 64% were men, 53% were white, 44% were Hispanic or Latino, and finally 28% of the total participants had PSA. Here we will discuss our findings. On the right here, we see a graph showing the mean preference for using the proposed medication in all psoriasis patients. The blue bar indicates the responses of the group receiving the gain frame message, and the red bar indicates the responses from the group receiving the loss frame message. Along the x-axis, we see our two groups, gain frame message and loss frame message. On the y-axis, we have mean preference score. We can see that the participants in the loss frame group had a significantly greater preference for the proposed therapy. On the left, we can see a more detailed look at the statistics and numbers. The difference between the groups was 1.73, which was statistically significant. Next, we'll take a look at our secondary analysis of decision framing and psoriatic arthritis. This time, we see mean response score versus PSA status, along with the comparisons between each group. Again, blue indicates the gain frame message group, and red indicates the loss frame message group. Similar to the previous slide, we can see that PSA and non-PSA participants had a higher preference for the proposed therapy after receiving the loss frame message. Below, we see the difference between the gain frame and loss frame groups for participants without PSA was 1.08, while the difference between the groups in participants with PSA was 1.9. We also evaluated for interaction between framing type and PSA status, and we did not find any interaction between those two factors. However, we found a statistically significant difference between the total PSA and the total non-PSA groups when combining their responses from both the gain and loss frame questionnaires. Regardless of the framing type, PSA patients always responded with a greater preference for the therapy. Finally, we will examine how sex affects the responses to gain-framed and loss-framed messages. Again, we see a bar graph of our results, and this time we have the groups for males and females on the x-axis. Like our previous analyses, both the male and female subsets had statistically greater preferences for the proposed therapy after exposure to the loss frame message. The difference between the gain framing and loss framing groups in men was 1.49, and the difference in women was 2. Both differences were significant. Again, we found no interaction between framing type and sex. Additionally, the total responses of men versus the total responses of women was not significant. In this study, psoriasis patients receiving a loss frame message had a stronger preference than those receiving a gain frame message for a proposed injectable medication. When presented with the potential of worsening psoriasis and/or PSA, along with the missed opportunity to improve skin, joints, and overall health, patients expressed greater desire to take the proposed medication than when the choice was gain-framed. Subgroup analyses showed that in both psoriasis patients with and without PSA, loss frame messages resulted in greater preference for the proposed treatment than gain frame messages. In addition, compared to patients without PSA, those with PSA had stronger preferences for the proposed therapy, regardless of receiving a gain or loss frame message. This may be explained by the strong desire of patients with PSA to avoid irreversible joint damage and long-term functional disabilities. Also, loss frame messages resulted in greater preference for the proposed treatment than gain frame messages in both men and women. Interestingly, no interactions were found between framing type and PSA status or framing type and sex. Therefore, each subset was equally susceptible to the effects of decision framing. One potential limitation of this study was a small sample size of PSA patients. There were a total of 25 total participants with PSA out of 90 total. Thus, we see that patient-physician communication is critical to shared decision-making. In clinical practice, physicians regularly weigh the benefits and risk of treatment. In order to communicate this information to patients, it is important to understand how framing of these benefits and risks impacts patient preferences for therapy. While most available biologics are effective and have tolerable safety profiles, many psoriasis patients may be hesitant to initiate these therapies. Thus, it is important to convey the benefits and risks of these systemic agents in ways that resonate with patients. We typically explain to patients the benefits of treatment. However, explaining to them the harmful effects on their skin and joint diseases, such as exacerbation of psoriasis and/or psoriatic arthritis, could offer some patients a new perspective that may influence their treatment preferences. And ultimately, better communication may lead to better medication adherence in patients. Thank you all very much for listening to my presentation. I really appreciate your time and your viewership. I want to also thank Dr. April Armstrong and the USC Dermatology research team for their guidance and support. Without them, the study would not have been possible, so a big thank you to them as well. Thank you all again very much, and I hope you all stay healthy out there during these unprecedented times. I hope you all have a great rest of your day.